Welcome to the all viewers and well-wishers of the world. Purpose of my lecture is learn the knowledge from the word and return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot, now to return a lot to the world. The topic of today is Herpes simplex. The introduction is that the other name of herpes simplex is cold sores or the fever blisters. Name is from the Greek herpes, which means to creep, so spreading the blisters. The name does not refer to the latency of the disease. It produces small blisters in groups, and the symptoms are blisters blisters that break open and form small ulcers with fever and swollen lymph nodes. There is tingling or shooting pain occur before the blister appears. Infections are categorized based on the body parts infected and their name according to the part of the body affected. Oral herpes involves face or the mouth, which is most commonly seen. So here one can see the blisters of the herpes. It is mostly seen on the lips, so-called herpes labialis, as one can see, and it can be the genital herpes that can be infecting the male and the female also, and it can be also on the hand of a person, and some other body parts of the person are also involved, so their names are according to the part involved. Now, genital herpes, simply known as the herpes, have minimal symptoms or form blisters. Frequency of the disease is 60 to 95% seen in adults, and the duration of the disease is 2 to 4 weeks, and the cause of the disease is herpes simplex virus, and it's spread by the direct contact, and the risk factors involved are decreased immune function, stress, and sunlight, which provoke this disease. Diagnostic methods are based on symptoms, classical PCR, and viral culture. The medications which are used for this disease are valaciclovir, aciclovir, paracetamol, acetaminophen, then topical lidocaine. Herpes cycles occur with periods of the active seed followed by the periods without symptom. So the cycles of the herpes disease do occur. The first episode is severe and have fever, muscle pain, swollen lymph nodes, and the headache. Over time, the episodes of the active disease decrease in frequency and the severity as it was the first one. Now, epidemiology. Worldwide rates of the either herpes simplex virus 1 and of herpes simplex virus 2 are 60 to 90% seen in adults. HSV1 is more common than HSV2. HSV1 rates are 70% and 80% in low socioeconomic group and 40 to 60% in the populations of improved socioeconomical status, that means the developed countries conditions. Rates of infections are determined by presence of the antibodies against either herpes simplex virus species, whether HSV1 or HSV2. Now the cause. Herpes viruses have a unique four-layered structure which are virus is responsible for herpes simplex. The virus have central core with large double-stranded DNA genome. It is enclosed by an icosa pentahedral capsid composed of many capsomers. It is surrounded by an amorphous protein coat called tegument, and this is again encased in a glycoprotein bearing lipid bilayer envelope. So here one can see the structure of that herpes simplex virus. So here is the nucleocapsid, and here is the lipid bilayer envelope, and here is the surface glycoprotein GT and surface glycoprotein GB. There are many surface glycoprotein which are seen in this herpes simplex virus. Then surface glycoproteins GH and GL and surface glycoprotein GC. These are all the glycoproteins which are protruding out from the envelope of the virus. Now, there is centrally DNA present in the virus, and then there is outside the tegument. So, that is the structure of the herpes simplex virus. Now, types of the virus or the classification of the virus. Herpes simplex virus is divided into two types. Each may cause infection in all areas of the body. HSV 1 causes primarily the mouth, throat, face, eye, and central nervous system infection, and HSV 2 causes primarily anogenital infection or genital infection. Genital herpes is classified as a sexually transmitted infection. It may spread to an infant during the childbirth from the mother to the child. Now, about the transmission of the disease, it's spread by direct contact with the body fluids or the lesions of an infected individual. Transmission still occurs if the symptoms are not present, means before the appearance of the symptom, transmission is possible. Genital herpes is a sexually transmitted infection which is called horizontal spread also, and the moist skin of the mouth and the genitals, including the anus or sharing the sex toys, is responsible for transmission of infection. It may spread to an infant during childbirth, that is the vertical spread, in comparison to the horizontal spread, which is sexually transmitted from one person to another. And here it is from the mother to the infant, which is called vertical spread. Even microscopic abrasion on the mucous membrane are sufficient to allow the entry of the virus. So, herpes virus causes and the risk factors are, as one can see, the virus, it can be skin to skin contact. It is seen in immunocompromised patients. Then it can have the unprotected sex between the two partners and the stress. These are also the risk factors sometimes. Now, two things to remember in the life are very important. Take care of your thoughts when you are alone, and take care of your words when you are with people. So, thoughts you are not going to share with others, and while speaking, you have to be careful for using the proper words. Now, certain risk factors are known. These are decreased immune or suppressed immune system, such as in the newborn, transplant recipients, or the people with AIDS, prone to severe complication from HSV infection. Then stress, sunlight exposure. People with HSV infection are also associated with cognitive deficit of the bipolar disorder and the Alzheimer's disease. It is said to be having some association with these cognitive deficit disease, but it is also dependent on the genetics of the infected person. So it is not the virus only. The genetics also have a definite role in the spread of these cognitive diseases. Now, the clinical features of the infect, infection are blisters that break open and form small ulcers. Tingling or shooting pain may occur before the blister appears. There is fever, swollen lymph nodes, headache, and muscle pains. Symptom develops 2 to 20 days after the exposure of virus and entry of the virus. The sores usually last 2 to 3 weeks, and many people infected with HSV2 display no physical symptom, described as asymptomatic or having subclinical herpes, and they have got no symptom with which they present. Now, symptoms of the herpes: blisters or sores in the mouth and the genital areas, red blisters on the skin, and lack of appetite. There is unusual vaginal discharge if there is involvement of the sex partner and there is HSV2 involvement, and pain during urination if the urinary system is involved, and the fever. These are the symptoms of herpes. Now, clinical features continued. HSV is never removed from the body by the immune system. Commonly infected are skin or the mucosa of the face and the mouth, so it is called orofacial herpes. When it is involved in the genitalia, it is called genital herpes. When hands or fingers are involved, that is called herpetic vitiligo. When eyes are involved, these are the herpetic keratitis, and the brain involved appear as herpes encephalitis. Newborn, when get this infection, that is called neonatal herpes, and the herpes cycles means active disease followed by no symptom. As I have already told, the first episode is very painful and causing problem. The first is more severe with constitutional symptom, and the later on cycles are not having that much severe symptom as the first one have. Now, there are recurring symptoms. Around 33% of the people with the oral herpes and 50% of those with the genital herpes, they do have the recurring symptoms and they experience these symptoms. Symptoms will be fewer, sores than in the initial phase. During a recurrence, a person can pass on genital herpes for 2 to 5 days. Now, the pathogenesis: after the primary infection, virus enters nerves at the site of the primary infection. Virus Viruses are transported along the sensory nerve to the nerve cell bodies and became latent in the ganglion. And here they reside lifelong. Virus enter to the nerve cell bodies via receptors like nectin-1, HVEM, and 3O sulfated heparin sulfates, which are present on the nerve cell bodies, and duration is 2 to 4 weeks. So here one can see there is attachment of the virus and the fusion of the virus with the cell membrane of the host, and then they get enter into the nucleus by making a nuclear pore, and then they have got the entry into the nucleus, and here they order by actually they have just hijacked the nucleus, and there is the viral DNA which is just going to have the RNA polymerase, and it fuses with the nucleus of the host cell, and then they trace the formation of the new virion bodies which is coming out from the nucleus, and there they are going to be assembled at the endoplasmic reticulum, and that is the new virion is formed, which is capable of infecting the other host cell. And here is the process by which these are coming out as exocytosis, mean just coming out from the cytoplasm of the host cell. And here one can see the many new formed cells from the one cell, that one cell, and that is going to be assembled and coming out. So here now the virus at the site of the viral latency is that it is the trigeminal nerve ganglion, and the site of the active lesion is the skin. When the virus come out from here to the skin and appear as the blister, but these just get latency and remain dormant here for years and years in the trigeminal nerve ganglion. Now, HSV is never removed from the body by the immune system. New body produces antibodies to HSV involved to prevent a later infection at a different site. And when the infection is there, the body produces antibodies. In HSV-1 infected individual, there is seroconversion after an oral infection. This prevents HSV-1 infections like vitiligo, genital herpes, and the herpes of the eye. So the antibodies prevent these involvement of the herpes with these parts of the body. Concurrent infection with HIV increases frequency of asymptomatic shedding of the virus. So now one can understand the pathogenesis. There is entry by the skin or the mucous membrane, which just lead to the virus multiplication, and there is lysis of the cells and the vesicles, and that lead to the ulcer formation. And when the virus multiplication occurs, these just released and get into the sensory nerve, and they ultimately go to the root ganglia, and then they go to the latency. And there is, when they are having the problem, the risk factors are the patient is having cold, fever, and other factors which are causing the problem like surgery and unknown. And when it is in the latency, it can lead to the reactivation, and then the virus become active, and that can lead to the herpes zoster infection or shingles. Now, there are different types of the herpes lesion. These are 13 types of the herpes lesion that is seen by herpes simplex virus. These are herpes labialis, herpetic gingivostomatitis, eczema herpeticum, herpetic keratoconjunctivitis, herpetic psychosis, herpes esophagitis, herpes genitalis, herpetic vitiligo, neonatal herpes simplex, herpes gladiatorum, herpes simplex encephalitis, HSE, and herpes viral meningitis, and some other lesions which are seen with herpes simplex virus.